about trichomonas. All right, I think that a lot of doctors don't explain trichomonas in the way that is understandable or appropriate, and I think a lot of people lose a lot of relationships because of trichomonas. Now, I like, aka trick, and trick is tricky. Okay, so for women, our symptoms are very quick, like malodorous discharge, meaning stanky discharge, a little on a fishy, crabby side. Sometimes can have irregular periods, sometimes can lead to some pelvic pain. It's just an annoyance, and you generally will go to the gynecologist thinking it's BV. Or you're like, something's not right. My periods have been irregular. I had couple of periods in a month. I spotted for a couple. It's always usually going to present with some smelly discharge and some weird period stuff if you've had it for a substantial kind of period of time. We test for it. It's easy to find. We treat it. A lot of doctors will only look under the microscope. I ain't got time for that because I don't want to miss it, because if it's old, because trick moves under the microscope. If it's old, it may not move. So I just send it to the lab as well. And it's just 4 pills one time and you're done. You don't have to take it for 7 full days, just 4 pills. The pills are disgusting, but 4 pills one time and you're done, right? I usually will wait 3 weeks, tell you not to have sex for that 3 weeks, bring you back in to test and make sure it's gone, and then clean bill of health, right? Okay, well, men are a little bit different in that men usually don't have signs or symptoms of having trick, right? They don't. They have no idea that they know that they have no idea that they have it. They can transmit it. They can give it to you, but they have no idea that they have it. And oftentimes what will happen is you'll go to your partner and be like, my doctor told me I got trick. You gave me an STD, right? With the neck rolling and all that jazzy, sassy, zesty stuff, right? Okay, so the thing is, they'll then go to the doctor, and the doctor will usually collect their urine and say, you don't have trick. And then here we go with the problems, because that's the only person you had sex with. The doctor's telling him he doesn't have it. And this is why for women, we have a urine hole and we have a vagina. Our discharge and our urine are intimately separated, close but separated. For males, they have one hole, the urethra. Everything comes out of there. Urine, semen, everything comes out of that same hole. Well, if you think about it in terms of concentration, right? So the infection is still there, the trick is still there, but let's say because of how much they pee, how much they ejaculate, they have, and this is minimizing it, so I don't need any scientists getting on here and be like, this is just ignorant. No, it's minimizing it so that people can understand it. So if you have this much infection, right? Because again, all you really need is this much to be, you need just a mustard seed to be able to give it to somebody. But if you have this much per se, but the test doesn't pick it up until you have this much, the test is going to come back as negative. But that person does have trick and is transmitting trick. Okay. So that is the big deal with trichomonas. So dudes are like, I ain't got it. And so they keep transmitting it because a lot of doctors are uncomfortable treating something where the test says you don't have it. So what I usually will tell my patients is tell your partner to go to urgent care or their doctor and say, hey, the person I'm having unprotected sex with has been diagnosed with trick and I want to be treated. There's no confusion that it is sexually transmitted. So regardless as to where it came from, because that usually ain't my business either. I don't know whether you gave it to him or he gave it to you, and I don't care. The point is that I'm going to treat it. So I'm sure every doctor would feel that way. So if you simply say my partner has been diagnosed with trick and I want to be treated, then you'll get treated, versus she said I gave her trick, I want to be tested for it. Because at the end of the day, if she has it and you had unprotected sex with her, now you got it anyway. So we may not ever know where it came from. But like I'll tell people, because it hides, if it's a new relationship, y'all been in a relationship for a month or 2 months, it's your first couple of times having sex, and all of a sudden you get tricked, give him some grace, ladies, because he may not have known that he had it. So you get treated, he get treated. Now he come up with anything else, then I can't help that man or woman, however you want to look at it. But if you've been in a relationship for 2 years, you've never had anything, and now all of a sudden you got tricked, it's another player in the game somewhere, okay? So that's a little skinny about trichomonas. I hope this blessed somebody. Have a good day.